Hi, my name is Eileen Quinn. I'm a registered nurse over at Honor Health in Arizona. I'm part of the National Organization for Nurses with Disabilities, and I'm going to show you how to insert an IV with one hand. A couple of people have been asking me for videos about this, so hopefully this will help you. So we're going to start by just getting everything set up. I think the most important thing when you're kind of not having two hands is to get everything set up so it's quick and easy sticking on stuff. So the first thing we're going to do is open up our IV start kit. So in our kit here, there's like a lot of stuff that's already in here. Some kits might be different, but a lot of them are pretty similar. So you can kind of get rid of the papers and all that and just lay everything out. So the first thing I will do is the little canister line. I will get that set up with our flush here. So you're just gonna open up your flush, and I leave the little canister line just in the plastic bag. And then it just keeps everything clean. So get the bubble out, hold it down with one arm, and you can even hold it down like here, whatever you have. You just hold it down just to keep it steady. You turn, and then just so you don't make a huge mess, you flush the saline through, you get some dots, you click, or some of them have a tab, but you lock the canister line, just so that's all done. So you're done with that. The next thing you're gonna do, so ours has like a two-part, this is like goes on the bottom of the line, but don't worry about that. Basically, as long as you have one of the bigger dressings here, what I do is at least get the top part off where you're actually gonna be sticking the sticker on first to keep the IV stable. And then I'll rip the other side off as I'm going to do it. But just to have like one side on so it's an easy like bam, done. Okay, then we have our little wipe, and I will get the IV out. Doesn't, it's just a video, so we're using a 20, but you use whatever size your patient can use. So we're all done setting up. So the next thing, the hardest part, honestly, is probably tying the darn tourniquet, which seems ridiculous, but I think when you have one arm, it's a little bit harder sometimes. So we're kind of using a dummy arm, so it's a little different, but basically you're gonna bring the rubber band behind your patient's arm, kind of get it even. The next thing is I use my elbow and I pull with my arm that I can actually use. So you tie the loop, the knot, and then you're just gonna bring it like this. And the reason is, I'll show you, is you wanna line like a little knot like that, because once you get the IV in your patient's arm, you just wanna be able to undo it. I'm gonna show the second time, if maybe you don't have as long of an arm, kind of maybe how you can accommodate. So you're gonna kind of hold here, maybe like here, with your elbow or something, and really pull with the arm you can use. Kind of tuck it under and pull like that. Still successful. And I didn't use any of my forearm, just like my elbow. You can use the back of your arm, anything you can use, just to keep something stable so you can really pull with the other side and it'll still work. Okay, we're ready to stick our patient. Okay, so usually there's a wipe like this, you crack it, and you're gonna have gloves on. I don't usually put gloves on when I'm tying my tourniquets because I feel like it's really hard and the gloves sometimes stick to the tourniquet, and you don't need to have gloves on when you're tying a tourniquet. I mean, unless they're bleeding everywhere, then of course you do, but usually for my gloves, sometimes when I'm doing IVs, I don't do this all the time, but I'll kind of put them like inside out, so then like the little fingers aren't in the way, and then you kind of don't have it like all over the place. Okay, so you're gonna wipe here. And you normally don't get this lucky and have a juicy vein like this, but we're fortunate here with this little fake arm. Okay, so now I don't, like most people with two hands kind of pull from the top and kind of do it like that. What I do is I could just kind of loosen the canister. You're gonna hear the unclick, let it go. Then you don't have to worry about being stuck with the needle. All right, you're gonna tell your patient obviously what you're doing. Okay, I'm gonna stick you so they don't fling your arm at you. And then you're gonna kind of go at probably like a 30-degree angle, obviously towards the heart. And you're gonna stick it. Since this is a dummy arm, unfortunately, we won't really get the flashback, what you wanna see. So let's pretend, I saw a flashback, yay! So what you're gonna do is advance the catheter in your patient. Now this is, you hold it here, and there's a safety right here, this button. And you're gonna click that button so you don't have a needle anymore. You're gonna undo your line. Then you're gonna attach the little line here to your catheter, okay? Screw it on to your patient. Okay. Now you're basically kind of more or less steady at this point. So I got my sticker on here, on the needle, kind of, and then I pull here. Kind of get that line on and secure it. Now, you're gonna unlock here and just test to make sure you still see blood. So you would pull back on your line and you would hopefully see blood, or push in a little bit and then draw back to see blood, you know, and then you see blood and you're like, yay, it's good. You flush the IV. And then from here you would finish up the dressing. But that's basically it. So the big thing is, you know, just making sure that your tourniquet is off your patient as soon as possible, as soon as you kind of get everything steady, and making sure your dressing is secure. And that's basically it. And I hope this helps somebody.